you can also use a hemoglobin A1C to separate these categories. So I gave you a lot of numbers. So the main thing to remember is fasting is under 100. 2-hour glucose, like when you eat a meal, if your sugar is going up above 140, that's an abnormal response. So 2-hour eating is under 140 and hemoglobin A1C is under 5.7. So those are the numbers you need to remember.
So is there more than one kind of diabetes?
Yes, there are two main types of diabetes. Type 1 diabetes is rare. It's seen only in 10% of patients and mostly seen in children, but it can be seen at any age. And it is an autoimmune disease. That means your immune system, which should react against things that are foreign to you, like if you get the flu or a pneumonia, the immune system should fight out the infection so that you get better. But in people who develop an autoimmune disease, it starts making chemicals against your own tissues. So in this case, it makes chemicals against the insulin-producing cells, which attack those cells and damage them. So these people need insulin right at the time of diagnosis. And thyroid disease, which I see fairly frequently in my South Asian population, most diseases are also autoimmune. Both hypothyroidism and hyperthyroidism are autoimmune. And then there is gestational diabetes, which is seen during pregnancy. And when a woman develops this during pregnancy, her risk of becoming diabetic again in the next 10 to 15 years is very high. About 30 to 50% of women become diabetic again. So 1 out of 2 to 3 women become diabetic again. Okay, so it behaves more like type 2 diabetes, where usually the risk is when the woman is overweight or obese. And what happens is when you have excess body fat, then your pancreas has to make more and more insulin because the insulin becomes less effective when there's more body fat. And after a while, the pancreas says, I can't do this anymore, and it gets exhausted. So at the time of diagnosis of type 2 diabetes, you have already lost 50% of the insulin reserve, and over time, you lose the rest, and that's when patients end up on insulin injections.
All right. So why did Deepika develop diabetes at such a young age?
Yes, so I'm seeing diabetes actually in my South Asian patients, Indians, Pakistanis, Bangladeshis, even in their early 20s. So, and here in the US, like there are children who are obese that are already diabetic. And there was just a paper recently that said those children can develop very rapid complications that we don't usually see for many years. So obese, she is obese based on her body mass index. Both parents have diabetes. So if one parent has diabetes, your risk is 40%. If both parents have diabetes, then your risk is 80 to almost 100% that you'll become a diabetic. She's South Asian. So India is called the diabetes capital of the world. And by 2030, we are going to have almost 100 million patients with diabetes. So we South Asians and also Southeast Asians develop diabetes at a much lower body weight. So if a Caucasian has to gain 50 pounds to develop diabetes, we do so when we gain just 5 to 10 pounds. So we don't look heavy, we just have more intra-abdominal fat, and that's what increases the risk of diabetes. And she also has had diabetes during pregnancy, which really escalates the risk. And here I just want to mention there is one condition called polycystic ovary disease, which causes irregular periods, acne, and extra body hair. So there's a lot of facial hair in these women. So these women are also more prone to develop diabetes.
What are the long-term problems in someone with diabetes?
Thank you. So when glucose remains high for several years, it starts attacking certain organs, mainly the eyes, the kidneys, and nerves. So the most common cause for blindness, kidney failure requiring dialysis, and amputation, where you have to remove part of the limb because there is some dead tissue in the limb, is diabetes. That's the most common cause for all these problems. And moreover, these patients are also at a very high risk for heart attacks, strokes, and circulation problems.
What is the role of diet in diabetes management?
I'll take over. And so we know obesity and a sedentary lifestyle is the causative factors for the prevalence of diabetes. And you know how diabetes affects the body's ability to use and properly make insulin. So what happens is there is high blood sugars. So the key thing is to keep your blood sugars in the normal ranges. That is the main thing of managing diabetes. So diet becomes a crucial component of the treatment modality. Okay, and when we look at diet, we have like macronutrients. They are another word for fuel, energy for us. So we have carbohydrates, we have protein, and we have fat as our macronutrients, but we are concentrating on only carbohydrate part of the diet to manage diabetes. So protein foods and fat foods, they do not really escalate the blood sugar to that extent as much as in carbs. So here we have a scenario where Deepika is having that South Indian diet, and it's like the heavy meal. So as a dietitian, when she comes to my office, I will first assess her in terms of how many carbs she needs, and then talk to her and see what kind of the foods that she's eating, because my whole idea is for her to recognize her carbs and know how to count her carbs. Okay, and when she reduces her carbs, we know consistently over time she will be testing her blood sugar and she will see an improvement in her blood sugar. That's only one part. Okay, generally we give you like 45 grams per meal. When I say per meal, breakfast, lunch, and dinner for females, and for males we usually do 60 grams per meal, and this is just general. And we usually do a thorough nutrition assessment. So let's give an example of a breakfast that she's eating, just for you guys to understand the carb concept. Carbs are usually, in 5 categories. Okay, they come in grains, which are complex, and then grains, and then you